Hello and welcome to the second of the three short films that introduce the subject of manual handling in the workplace. These films are provided in advance of any formal manual handling training that your role within the workplace requires. Each of the films deal with a specific aspect of manual handling. This second film looks at the problem with your back and how it gets injured. The first film examined the legal requirements for manual handling, and the third will examine the basic safe lifting practices that you can apply to prevent or reduce the risk of you suffering from back injury, harm and pain. Each film lasts approximately 5.5 minutes, so if you still have a hot or cold beverage to hand, let's begin. Why is your back at risk of being harmed or injured during workplace manual handling activities? The reality is that your back is at risk at all times. It's just that at work you may be required to perform manual handling activities more than you would at home or in your social activities. And if you perform any act incorrectly, the result is often pain, harm and injury. To understand this more, let's examine your back. Your back is comprised of a column of bones known collectively as the spine. The spine is made up of 33 individual bones called vertebrae. Some of these are fused together to form a solid lump at its base, but 23 of the vertebrae are separate from each other. What separates them is a fibrous jelly-like pad called an intervertebral disc. Your spine is divided into 4 main regions: cervical, neck region, thoracic, chest region, lumbar, abdominal region, and the sacral coccyx, the pelvis region. Your spine provides support for your body structure, and it's an essential element to aid your balance so that you can walk upright. It also provides protection for the main nerve extending from the base of your brain. This nerve is known as the spinal cord, and it passes through the convenient hole at the back of each of the 23 vertebrae. The spinal cord branches out either side of those areas where the vertebrae meet. These branches of the spinal cord extend out into the nearby area of that body to control and respond to any stimulus in the area. The vertebral bones in your spine are kept together using connective tissue that combine along with a muscular sheath around the spine to keep the column of vertebrae in place. As you would expect, such a complex structure is bound to have a weak spot or two. In fact, it has 23 weak spots, the intervertebral discs. Used properly, your discs will continue to provide their main function, providing limited movement of the spine and to act as a kind of shock absorber for the column of bones. But improper use can see the disc damaged or suffer wear and tear. This can cause the inner jelly pad within the disc to be squeezed out through the worn or damaged disc walls. When this happens, it's known as a prolapse disc. Where the bulge touches the branches of the spinal cord, it can cause severe pain to be felt. In extreme cases where the jelly pad ruptures and escapes the disc, then the resulting pain will be agonizing, as the jelly pad is in fact a strong body acid. Acid directly making contact with a live nerve is not a pain you readily want to feel. So how do the intervertebral discs get worn and torn so easily? This is all down to our failing to adopt a correct lifting or handling posture. As we will see in the third film, our problems occur because we forget the correct way to lift in the manner that presents little risk to us. And yet it's not just our back that is prone to injury through manual handling activities. Medical research shows that our hands, arms, shoulders and feet are susceptible to being injured as well, although usually this is due to our failure to take sensible precautions. For example, hand injuries are caused by our failing to wear protective gloves. Arm and shoulder injuries are caused because we try to lift something too heavy for us. And feet are injured when we drop items that are too heavy for us to carry safely. These types of injuries we will feel there and then, and these are referred to as acute injuries. However, back pain and back injuries are referred to as chronic injuries. They take time to develop, but once they do, they don't go away. There is a good chance that you are damaging your backs right now as you watch this film. You won't be aware of the damage being caused until your later years. But if you ask anyone who has experienced chronic back pain, they will tell you that they wish they had known what to do in their earlier years to prevent having it now. Our work brings about the activities that can increase the risk of back pain and injury, but your life outside of work also has the same risk too. Lack of exercise, poor diet and failing to take care of your back when we walk, sit and sleep can all add a little bit more wear and tear to the spine's weak spots. We need to take more care of ourselves to protect our backs. Fortunately, while at work, there are specific legal duties for you and your employer to follow that, if applied properly, will reduce the chances of your back being injured. Unfortunately, there's nothing in your social life that demands that you take care of your back. Before we look at the last in this series of introductory films, let's summarise what we've learned so far. There are specific UK health and safety laws that direct employers and employees to uphold their duties of care, to maintain a safe workplace, and to assess and reduce the risk from manual handling activities. We saw that in film 1. Your back is a complex structure that is prone to chronic injury and pain conditions where you fail to use it correctly. Work activities can cause an increased risk of back pain and injury, but so too can your social life activities. Back pain is avoidable, providing that you take appropriate care and adopt the risk control methods to ensure that you keep your back in a safe condition. That's the subject of our last film, keeping your back safe. If you haven't viewed film 1 yet, now will be a good time to do so. Thanks for watching, and we'll meet again in film 3.